Hi, my name is Dr. Lou Prevosti. What I love about being a vein doctor is the human interaction with the patient. That is really important to me. Also, I love using my abilities as a doctor and a surgeon to help people. My background as a cardiothoracic surgeon influences the way I approach vein medicine surgery in several ways. Number one, meticulousness. As a cardiothoracic surgeon and a heart surgeon, you have to be meticulous in all aspects of care, from diagnosis to the technical aspects to the follow-up care. And that translates very well into vein practice. I started my medical education at Albany Medical College in Albany, New York. Very good experience. And I say I learned how to become a doctor there. And then my journey took me to Cornell Medical Center, which is in New York City at the New York Presbyterian Hospital, where I did my general surgery residency. And that spanned about 5 years. And that's where I say I learned to become a surgeon. Once I completed my general surgery residency, I then went to the Cleveland Clinic in Cleveland, Ohio, and I did my cardiothoracic surgery residency there. And that's where I learned to become a perfectionist, because that was also an amazing experience, not only learning cardiothoracic surgery, but seeing how an organization, a world-class organization like the Cleveland Clinic, functions as a unit. And that has carried through to my practice as a cardiothoracic surgeon and also to my practice in the vein clinic as well. My approach to patient care at its very foundation is the golden rule and the platinum rule. Now, we all know the golden rule is do unto others as you would have them do unto yourself. So I imagine I'm the patient. How would I want to be treated? With respect, with understanding, with concern, with care. And then the platinum rule is treat the patient how they want to be treated. Sometimes a patient may want something that maybe I might not think of. I want to treat that patient as an individual the way they want to be treated. I want to gain a patient's trust. So I want integrity, honesty, sincerity, in addition to all of the highly skilled technical part. A typical patient experience in our office is when they come in for the initial consultation. That can take up to a couple hours, because as part of that evaluation, we do a venous ultrasound to check for venous flow, and that alone takes about an hour. And then the consultation with me, which can vary in the amount of time. When I start my interview, my consultation with the patient, I like to let the patient talk for as long as they want about the issue that brings them here. So I know firsthand what is first and foremost on their mind. And then once I start to talk about the findings of the ultrasound and the physical exam, and they explain the treatment plan that I suggest, I also, towards the end of the consultation, will stop and ask if they have any questions. And I will answer as many questions as they have. I want to make sure that I am listening to the patient and what they're telling me throughout, and give answers that they understand. And then once we've completed that, we take that treatment plan and we submit it to insurance companies for what's called prior authorization. A lot of these procedures are covered by insurance companies if they meet certain criteria. Most treatments are rather short, usually less than 30 minutes long, and recovery is very quickly. A patient can walk and drive immediately after the procedure and get back into normal light daily activity with minimal discomfort immediately. And then we do several follow-ups over the next several weeks and several months to make sure everything's going okay. What I hope patients take away from their initial consultation with me is that they found the right doctor for themselves. They found a doctor that they believe listens to them, that understands them, also that alleviates some of their fears and anxieties about going into a vein clinic for evaluation and possible treatment. I want to convey that that patient leaves knowing that they found a doctor that will take care of them in a compassionate and very precise way.